If you or someone you love is expecting, congratulations! Bringing a new life into this world is a beautiful thing. Expecting a baby can bring a range of emotions, and sometimes you might feel overwhelmed trying to learn everything that you can. We have created this overview of the first trimester to inform you on what you can expect. In the first trimester, many women will experience nausea or morning sickness. The term morning sickness is somewhat misleading because the truth is, you can have this nausea at any time of the day or night, not just in the morning. There are some women that never have morning sickness and nausea, while there are others who may get very bad and debilitating morning sickness. It's also important to note that every pregnancy can be different, even for the same woman. Another very common complaint in pregnancy is exhaustion and fatigue. You may find yourself sleeping 9 to 10 hours a night and still requiring a 2-hour nap every afternoon. Or if you are lucky, you may have energy with just a normal amount of sleep. Babies go through a lot of growth in the first trimester. After fertilization, an egg starts traveling through the fallopian tube to implant itself on uterine walls. Body tissues develop into legs and arms, the pancreas starts producing insulin, liver starts secreting bile, and ovaries and testes are growing depending upon the sex of the baby. There are also a lot of changes for you in the first trimester. During the first trimester, signs and symptoms of pregnancy are at its peak. The first symptom that a mother can face is nausea, and it may continue with vomiting. Morning sickness generally lasts till the end of the first trimester, and it can cause fatigue and tiredness. Sometimes these symptoms start even before a missed period is noticed. Tenderness in breasts and tendency to urinate frequently are common signs of the first trimester. Other common symptoms in the first 3 months are morning sickness, tender breasts, greater urination, fatigue, food cravings, and heartburn. Your sense of smell can also be very sensitive in the first trimester. An increase in hormones can lead to emotional outbursts and mood swings. In the case of severe back pain, extreme nausea, bleeding during the first trimester, or other problematic symptoms, it's always best to consult with your doctor. In the first trimester, some women will develop a huge belly and there will be no denying that they are pregnant, while others may be able to get to the 9th month before anyone notices the changes. The way each body holds the pregnancy is different, and it depends on your individual physique. Water retention is also a thing in pregnancy, so don't feel bad if you can't fit into your jeans after the first or second month. Any weight gain that happens as a result of pregnancy can be lost faster if you choose to breastfeed your baby after it's born. If you have just found out that you are pregnant, it's important to make an appointment with an obstetrician as soon as possible to check on the baby and see how far along you are. The first prenatal visit includes calculating due date, examining medical history of the patient, and checking on you and the baby. It's also important to know that basic development of nervous system in a baby starts in the first trimester. Ensure your baby is growing properly by taking a prenatal vitamin. We hope that you have found this video informative. On behalf of pregnancyhealth.net, thank you for watching. And remember, always consult with your doctor regarding any questions that you may have during pregnancy.